Roughly 1 in 5 people with anxiety disorders try to manage their symptoms by drinking alcohol, but instead of calming nerves, this habit often fuels a deeper problem. Let's start with what self-medication actually means. It's when someone uses alcohol or sometimes drugs to manage symptoms of a mental health condition, in this case, anxiety. The image of someone pouring a glass of wine to take the edge off isn't far from reality, but what may start as a coping strategy can quickly slide into a pattern that makes anxiety worse over time. Now, despite common belief, most people with anxiety don't self-medicate. National data shows only about 20% of individuals with anxiety disorders say they use alcohol to manage their symptoms. That number surprises a lot of people. It's easy to assume self-medicating is the norm, but it's not. What's more important is who is more likely to do it and why. Let's break that down by anxiety type. People with generalized anxiety disorder, the kind marked by persistent, uncontrollable worry, have the highest rate of self-medication, around 36%. In contrast, those with social phobia, especially fear of public speaking, are far less likely to drink to cope, at under 8%. Demographics matter as well. Men are more likely to self-medicate than women, about 55% versus 45%. White individuals are also disproportionately represented, making up over 80% of self-medicators in some studies. And people who are divorced, separated, or widowed are more likely to fall into this category. These details aren't about labeling, but about understanding risk. Because the more we know about who is vulnerable, the better we can intervene. So what happens when someone with anxiety starts using alcohol to self-medicate? At first, it might seem helpful. Alcohol acts as a depressant. It can relax you, dull your thoughts, and temporarily mute anxiety. That's the hook. But the effects don't last, and the long-term impact can be severe. Self-medicators drink more heavily than others with the same anxiety disorders. This raises their risk for alcohol dependence. Studies show that people who self-medicate are between 2.5 and 5 times more likely to develop a new substance use disorder, even when you account for age, gender, and existing mental health conditions. But it's not just about addiction. There's also a sharp increase in mental health symptoms. Self-medicators are more likely to experience depression, mood swings, and serious distress. Almost half report suicidal thoughts compared to less than 1 in 5 of their non-self-medicating peers, and nearly 1 in 4 has attempted suicide. Quality of life also suffers. Even when anxiety and alcohol use are both being treated, those who self-medicate report worse mental health and lower day-to-day functioning than those who don't. So while the goal might be relief, the result is often a deeper hole. Here's where things get more complicated. The relationship between anxiety and alcohol is bidirectional. That means one feeds the other. In some cases, anxiety comes first, especially with disorders like social phobia or agoraphobia. People often start drinking to manage fear in social or public settings. Alcohol calms them down in the moment, which makes them more likely to keep using it as a tool. But in other cases, alcohol use comes first. For people with panic disorder or generalized anxiety, drinking, and especially withdrawal, can trigger anxiety symptoms. Withdrawal effects like sweating, trembling, and a racing heart can mimic panic attacks. And over time, this can create long-lasting anxiety symptoms even after someone stops drinking. Some researchers talk about something called protracted abstinence syndrome. That's when anxiety symptoms linger long after quitting alcohol, sometimes for up to 10 years. So what starts as drinking to feel better often ends up making anxiety worse. Then people drink more to manage the new symptoms. That's the cycle. This isn't just theory, it's backed up by clinical research. Psychologist Matt Kushner described this as a feedback loop. Anxiety leads to drinking, which leads to dependence, which then intensifies anxiety, especially during withdrawal. The loop reinforces itself. Breaking that cycle means we need to treat both problems at the same time, not just one or the other. So let's dig into the psychology for a moment. Why do people with anxiety choose alcohol in the first place? One major reason is something called alcohol outcome expectancies. These are beliefs about what alcohol will do. If someone thinks alcohol will calm them down or reduce anxiety, they're more likely to reach for a drink when they feel stressed. But here's the twist. These expectancies change during a drinking episode. Most people believe alcohol will ease anxiety when they're at peak intoxication. But as the buzz wears off, fewer people expect these calming effects to last. That drop-off creates pressure to keep drinking, just to maintain the initial relief. There's also the issue of personality. People with high harm avoidance, meaning they're shy, cautious, or overly sensitive to stress, are more likely to self-medicate. They're wired to avoid discomfort, and alcohol becomes a shortcut. And then there's coping style. People who lack healthy coping strategies are more likely to use alcohol as a fast-acting solution. That's not about weakness, it's about a skills gap. When you haven't been taught how to manage stress or challenge your thoughts, alcohol looks like a quick fix. But over time, that quick fix backfires. Here's where things get even more critical. People with both anxiety and alcohol problems, what we call dual diagnosis comorbidity, don't respond well to standard treatment. In one study, people with co-occurring anxiety were twice as likely to relapse within 4 months of finishing residential alcohol treatment. That's a huge difference, 52 versus 21%. So why doesn't traditional treatment work as well? Partly because it often treats the disorders separately. A lot of programs either start with alcohol treatment and delay mental health therapy, or they run both in parallel but without coordination. Integrated treatment, dual diagnosis treatment, changes that. It addresses anxiety and alcohol use together in the same setting with the same team. The most promising approach, cognitive behavioral therapy or CBT. Kushner and his team developed an integrated CBT model that combines psychoeducation, cognitive restructuring, and exposure therapy. So here's how it works. Patients learn how anxiety and alcohol use interact. They challenge the belief that alcohol is the only way to feel better, and they practice facing anxiety-inducing situations without relying on alcohol. In a clinical trial, patients with social anxiety and alcohol dependence who got integrated treatment, dual diagnosis treatment, had better outcomes than those who only got alcohol-focused care. Not only did their drinking improve, but so did their anxiety and quality of life. That's the power of treating the whole person, not just one diagnosis. So what does this mean in clinical practice? It means that we need to look out for the early signs of self-medication, especially in people with known anxiety disorders. We should be asking more than just, do you drink? We should be asking why they drink. Do they reach for alcohol when they're nervous? Do they feel like they need it to function in social settings? Do they drink to sleep or stop worrying? These are red flags that signal a deeper issue. Prevention starts with education about what alcohol really does to the brain, how it interacts with anxiety, and what alternatives are available. It also means building better coping skills early, especially for people with high harm avoidance or poor emotional regulation. Teaching people how to tolerate discomfort, challenge unhelpful thoughts, and stay grounded under stress is key. And finally, it means promoting treatment models that don't just address alcohol, but anxiety too. Self-medicating with alcohol might feel like a solution, but the long-term costs are high. It increases the risk for addiction, worsens mental health, and lowers quality of life. The relationship between anxiety and alcohol is complicated, but treatable. With integrated dual diagnosis care and the right support, people can break the cycle and recover more fully. That's all for today, folks. My name's Dr. Ferghal Armstrong, and this has been Cracking Addiction.